Today we will be discussing sizeism, body size, and how that intersects with oppression and marginalization. Um, Keeping in mind the spectrum of oppression that we're discussing here has larger or fat body sizes being the most oppressed and marginalized population in the United States of North America, and more skinny or smaller body sizes being less marginalized and less disenfranchised in our population. As always, all body sizes are there's a possibility for all body sizes to be harmed in our society or to be shamed, but the prevalence of body shaming and repression and oppression around body size is happening towards larger body types or fat body types, particularly in uber healthy places um, such as Boulder, Colorado, and other places around the country where larger body sizes are generally discouraged and are the minority body size in the area. These places often have their own problems, such as maybe healthy lifestyle addictions to a certain extent, and maybe eating disorders that are more similar to anorexia and bulimia, but that is a discussion for another day. That being said, in this discussion, this is the spectrum that we will be um, looking at generally as we discuss the mental health implications, mainly speaking of the mental health implications towards larger body sizes. And today, for the first time, we will also be moving into the component of the lecture that discusses some of the common mental health consequences of oppression towards larger body sizes and some of the suggested modalities for working with people in this population in supporting them in their mental health journey. In addition, there are resources that are available to you around terminology and around what is obesity, what are eating disorders such as um, anorexia, bulimia, and binge eating, mnemonics, and others as well, as we move towards away from a sort of body neutrality vibe towards a body positivity energy in this field. So, as always, we will begin with a textual analysis from the Sioux text on cultural competency and counseling. And we'll begin by defining Sizeism as a form of discrimination and prejudice directed generally at individuals based on their body size. Again, most often against those in larger bodies. This prejudice operates through negative stereotypes, social stigmas, and systematic inequities that tend to privilege thinness and smaller body sizes while devaluing or marginalizing people who do not conform to dominant body ideals. And with all of the oppressions that we discuss or the identities that are oppressed, there's intersectionality, and that is no different. Here, particularly cisgender women deal with an intersection with sizeism that is incredibly harmful, that we will discuss briefly as well. The key elements of sizeism, as explained in the Sioux text, are that it frames larger bodies as undesirable, unhealthy, or morally inferior, to be honest, as if there's something wrong or there's some sort of laziness or personal problem or attribute with people in larger bodies that makes them sort of inferior. It influences opportunities in employment, healthcare, education, and in social romantic relationships. It is often maintained, sizeism is often maintained by cultural beauty standards, which also discriminate against elderly. Media representation of larger body sizes versus smaller body sizes and what that means there, and institutional practices. Similar, but not the same, as racism, sexism, and ableism, it does intersect with other forms of oppression and intensifies the marginalization when it comes to body size and people of color, body size in women, and body size in the LGBTQA plus individuals. In the United States of North America, particularly, the dominant beauty standard privileges thin, white, young, able-bodied, heterosexual, middle-class women, and fat women are generally systematically excluded from the standard of beauty promotion in the United States of North America. And as I mentioned, sizeism does overlap with other oppressions. The fat stigma towards Black and Latino women is often entangled with racism and classism, and we'll discuss that a little bit later as well. To further that point, different groups of fat women or larger bodied women, particularly, and people generally, experience sizeism differently. Um, for example, Black women generally may embrace broader body ideals, but still face racist and sexist stereotypes and sexualization around their body size. Um, Women in poverty face both class stigma and food insecurity narratives that intersect with body size. And lesbians, particularly, may resist some thin ideal pressures, but still encounter fat stigma within the lesbian community. To name a few examples of intersectionality and sizeism, not to say that this is an exhaustive list of how sizeism intersects with other identities. Sizeism is often neglected in social justice issues in psychotherapy and counselor training. I have personally added sizeism, whereas KCREP and other governing licensure and accreditation bodies have not asked for it to be or required it to be a part of the discourse. Therapists ought to integrate my perspective is that therapists ought to integrate fat activism into counseling as a means of healing and empowerment, and that larger woman or fat woman experiences cannot be understood without considering intersectionality. A few of the problems that have been identified um, are psychologists and counselors often perpetuate weight stigmas by adopting the medicalized view of obesity as a disease. And we'll discuss that a bit more later in this lecture. Fat shaming and bias from mental health professionals undermines therapeutic relationships and harms clients. So, this is where you doing your internal work and looking at your views of how you experience and perceive size intersects with how you show up for your clients of various size. So, checking yourself and looking at your assumptions and stigmas and putting them to the side in your therapeutic relationship is one of the ways that you can work to not invalidate your client's experience with size. And it's not just invalidation that I keep talking about, it's also supporting, right? You are a sort of polished mirror reflecting your client back to themselves. And building a healthy, trusting relationship begins with respect, right? And stigmas and stereotypes and your nonverbal and verbal communications of them can greatly impact and negate the trusting relationship that can be harmful in the therapeutic relationship. Educational programs rarely address sizeism, unlike this program, leaving future therapists unprepared. The standard therapeutic approaches focus on self discipline and individual responsibility, and they often ignore systematic discrimination. And whereas self discipline and individual responsibility are valuable, so is acceptance and compassion for oneself in various body sizes, and ignoring systematic discrimination and the impact of society, unhealthy foods in our cultures, promotions of minimizing body sizes as norms of beauty standards, impact on one's mental health. These sort of things are not seeing your client of various sizes as a holistic person. There's also anti fat prejudice that leads to body dissatisfaction, eating disorders, and shame particularly in certain populations, and that is not to be ignored in the therapeutic process. What is being proposed now is that we move away from weight loss models towards size acceptance, informed by fat studies and body diversity. That is taking the onus fully off of the client and placing it in a system that is more accurate to the impact and the prevalence of various body sizes in the United States and North America. We also need to be, and we're also working towards training psychologists to recognize sizeism as an intersectional identity, as I've talked about, that's similar to racism, sexism, and ableism. And that's part of my job here as a professional in a training program for mental health counselors. We're also promoting, as I am, self-examination and continuing education to reduce bias in practice in regards to sizeism. Some of the therapeutic alternatives that are coming around now as more of a body empowerment approach rather than a body shaming approach is to use the health at every size, or HAES, and body acceptance programs, right? A few examples are the Body Project, Positive Bodies, and we're using these to dismantle internalized fat stigma. Also, engaging clients in activism as therapy, from microactivism, such as challenging harmful language, to larger community and political actions that support people in larger bodies and being treated fairly and having more equal access until we have complete equal access in our society, and no marginalization and unfairness based on body size. Activism builds empowerment, it reduces shame, and it connects clients with supportive communities. And in my opinion, it is part of your ethical responsibility as a competent counselor to engage in these approaches. So, some of the counseling implications to close out the section on text analysis um, to consider is that activism is not for every client. Therapists must collaborate to find individualized forms of activism that align with clients' identity and readiness. And you are never to force your client to teach you about various body size and how it may show up in their mental health, or force them to engage in activism. You are there to support them in engaging in activism where they choose to do so, and not restricting them or invalidating their interest in participating in micro and macro activism around combating sizeism. Therapy should resist reinforcing the thin ideal and instead foster self acceptance and systematic awareness, as I mentioned. You, as a practitioner, ought to avoid a one size fits all approach. Understanding how weight stigma intersects with other marginalized identities is essential, and cultural identities, and that everybody views their experience with their body size differently. For example, not every client in a larger body is depressed about that. There is empowerment and liberation in various body sizes, and larger body sizes are not immune or separate from that as well. So, imposing mental health challenges or disorders or inflictions onto somebody because of their larger body size is unethical practice and not cultural competent counseling. And as always, therapists should validate clients' multiple identities, recognize compounded oppressions, and validate their experiences when they arise with mental health, physical health, and spiritual health as it relates to oppression and marginalization around body size, otherwise referred to as sizeism. And always, if you choose to, challenge systematic structures of fat oppression, not just your internalized bias, which is incredibly important, but also challenge the system so that eventually we do not have bias as a experience that is had in our society. There's a text called "Fearing the Black Body" that does discuss the intersection of racism and sizeism, that this sizes construct goes back to the transatlantic slave trade in the 1700s, is the one of the promotions in this text, that there were people that asserted that there are a direct link between blackness and fatness, and marginalization and oppression in our society, and that after skin color, body size and shape is one of the most marked physiological characteristics between Black and white people. And why were these differences important? Because these people that were arguing the physiological characteristic differences between Black and white people, which is not accurate wholly, were using it to justify slavery and control of the body. And the body is exactly what we're speaking about here. The body as it shows up in various sizes as a form of diversity, which is natural to our species. And this text reiterates, if you're interested, the Eurocentric idea of the thin white body as it was associated at the time and still is to a certain extent with intelligence, rationality, and the human ideal of body size. So that we can't separate when we discuss sizeism, we can't separate it from its racist roots. And this is an ongoing um, situation that we must combat together from that author's perspective. The body is not an apology, is this concept of radical self love that moved beyond self acceptance, self esteem, and self confidence to actually being liberated in our body sizes, particularly in larger body sizes, as a way to combat the stigmas and the stereotypes and the marginalization of larger body size. And a few things that you can think of as a mental health counselor, a few questions for yourself, or one question for yourself is, are you living with unexamined assumptions about your own identity and your own body size? And what does that mean for you and your practice? The values we hold about body size affects the values we recognize in other bodies, particularly in the somatic realm and in a therapeutic relationship. We are never just one thing. And radical self love embraces all parts of ourselves. And if you're interested, please continue to look into The Body is Not an Apology. These are just a few resources. In our society in the United States of North America, body size is still, sizeism, excuse me, and sizist beliefs are still considered relatively acceptable. And sizeism and fat phobia function as powerful stand ins for racism, classism, and misogyny in many cases. And despite the current beliefs that are promoted generally in our society, that phobia isn't grounded in science, reason, ethics, or economics. And we'll discuss briefly a little further in this lecture what that means specifically. The history of fat phobia is complex and reflects our culture's struggle with a legacy of intersectional oppression and hatred. And that can be incredibly harmful towards people of larger body size. And the fear of being in the category of larger body size is often what impacts a person's eating disorders when it comes to anorexic bulimia and so forth, um, smaller body size. The wanting to obtain a smaller body size because of larger body size shaming often leads to these um, disorders. And here you can see that you can read here the slide yourself or pause it. Um, but this perspective ignores social and economic factors that influence size, right? This medicalized perspective that I brought up earlier is kind of spoken to in this quote. The real issue now is how a patient is counseled, not how long, right? So working with your patient and being responsive and a polished mirror and understanding liberation and body empowerment is going to go a long way, regardless of how long you have to work with your specific client. And this energy can be held with all experiences, with all clients. And just another reminder that obesity is often perceived differently across cultures and across societies. In some societies, higher body weight is associated with prosperity. It just happens to be in the United States of North America um, that the stigma and the oppression is towards the larger body sizes. So here are some of the reasons someone might be of fat or of a larger body size that has nothing to do with personal choice. Genetics, some folks who are born cesarean or cesarean birth, medical conditions such as hypothyroidism, medications such as one used to combat diabetes, hormones from various things, medications, birth controls, um, steroids, and other things, unhealthy foods that can be addictive, that are a societal concern or a societal issue, food deserts. These are places where healthy food is absolutely not an option, and trauma can also impact someone's experience. Also, keeping in mind that many obesity treatment options, including bariatric surgery and some medications, um, we have Ozempic now is the big one, are inaccessible to lower income populations. So just thinking about what role does economic status play in access to healthcare and nutrition, and what impact does that have on size and therefore sizeism? And just kind of reminding you of this medicalized model that we're starting to move away from, just so you have an understanding of what it is, that doctors too often believe people with obesity are lazy, eat too much, and lack the willpower to maintain a healthy diet. And we perpetuate that as a society often. And even in our profession, we do as well. So checking in with yourself to see what you believe, and showing up for your clients in a non-harmful way is incredibly important here. Because sizeism does have an impact on one's mental health. And your job is to encourage mental and physical well-being over weight loss. You can choose to challenge the medical bias regarding weight and health, but you are not to focus on weight loss as a solution. You are there to support your client in finding liberation around their size. Now, if your client does want to focus on weight loss, you can support them in that. But recommending and imposing weight loss to a client who is struggling with anxiety without addressing underlying psychological issues can leave the client feeling judged rather than supported. Here are some of the possible mental health impacts of sizeism. I'm realizing now you might not be able to see all of them. So here's a moment you can pause and read. And I apologize for that, the way that the slideshow has been structured. But some of the impacts here are negative self-perception, social isolation, stress and anxiety, depression, and disordered eating behaviors, and more. It doesn't mean that everybody with a larger body size is going to experience any of these mental health impacts. These are just some that are possible. Negative self-perception can come from experiencing sizist comments or attitudes, and it can lead to a negative self-image, causing individuals to feel ashamed of their body and impact their self-worth. Social isolation can come from fear of judgment or discrimination based on size that can lead people to withdraw from social situations, contributing to a feeling of loneliness and sometimes isolation. Stress and anxiety, constant exposure to sizes, attitudes, and media can trigger stress responses, leading to increased anxiety levels. Depression can possibly arise from internalized negative feelings associated with sizeism that can significantly contribute to the development or worsening of depressive symptoms. And then disordered eating behaviors. Sometimes an attempt to conform to societal beauty standards, individuals experiencing sizeism may develop unhealthy eating habits or eating disorders, as I mentioned earlier. And people facing sizeism may hesitate to seek healthcare due to fear of judgment from medical professionals, potentially delaying necessary treatments in their lives. And that's maybe the intersection with the medical field. So we'll start with negative self-perception, and we'll go through and talk about a few modalities that may be able to support, or that you may be able to use as tools to support your clients that are experiencing Sizeism. CBT, cognitive behavioral therapy, which focuses on thoughts and behaviors, can help individuals understand how their thoughts directly influence their feelings and behaviors, allowing them to identify and modify negative self talk when it comes to stereotypes and images around sizeism and tropes that arise in our society. CBT also has a component of cognitive restructuring, and it's a core technique where individuals are taught to challenge and replace unhelpful negative thoughts, in this case, about their size, coming from these stigmas in our society, and to replace them with a more positive and realistic ones. And then behavioral activation is another component of CBT, which encourages our clients to engage in activities that promote positive self-esteem and identity development in regards to their size. ACT, or acceptance and commitment therapy, focuses on accepting negative thoughts and emotions while committing to values and taking action towards a meaningful life. And this is an approach that I'm just introducing now, this modality, but there's many more layers to it that can be helpful in supporting people who are experiencing sizeism and negative self-perception as a result of sizeism in our society. There's psychodynamic therapy, which explores unconscious patterns and maybe early childhood experiences around sizeism that may are sizist experiences that may contribute to low self-esteem and identity concerns. There's narrative therapy, which is where you help your client in constructing a more positive story about themselves and their size by examining and reframing their life stories around size. And then there's compassion focused therapy, or CFT, which promotes self-compassion and kindness towards oneself to counteract negative self-criticism that may arise as a result of sizeism. And these are just a few of the modalities that may be helpful when it comes to combating um, negative self-perception. When it comes to stress and anxiety that may arise as a result of sizeism in larger bodies, we have CBT again, which is a type of psychotherapy that can help with anxiety, depression, and other symptoms that does involve this gradual confronting of fears through exposure therapy that often can help build confidence that can help in managing anxiety symptoms that might be related to experiences of sizeism. CBT can be conducted in groups or individually, and it can even be done virtually. For stress and anxiety, we have hypnotherapy as well, which is sort of an alternative mental health approach, which is a relaxing process that can help reduce anxiety and anxious behaviors. And hypnotherapy can also help build confidence and increase motivation. That can be helpful in larger bodied populations that are dealing with sizeism. We also have RET, our rational emotive therapy, which is a short-term treatment that can help identify, challenge, and replace self-defeating thoughts and feelings. RET sessions typically include learning problem-solving skills, cognitive restructuring, and coping techniques. And it is a mildly somatic-based modality. And please, this is just the tip of the iceberg in terms of these tools and these modalities that can be useful. Please look deeper into any of them that vibe with you. And then another alternative to supporting folks that are experiencing sizeism in larger bodies is Tai Chi, a practice that can often produce significant reductions in anxiety. There was even a study that showed that patients with anxiety and fibromyalgia who participated in Tai Chi for a week a year experienced 20 to 25% treatment effect in regards to lowering anxiety, and continue to look into that for yourself. Then depression is another potential response, totally normal response to sizeism in larger bodies. And here are a few of the modalities that are helpful when it comes to supporting people in overcoming depression. I apologize, I should let you see the screen here. Interpersonal therapy, or IPT, transcranial magnetic stimulation, or TMS, and herbal remedies as well can also be supportive in combating or to minimizing the impacts of depression that might come around as a result of Sizeism. In IPT, you focus with your client on how their life events and relationships have been impacting their mood around Sizeism. IPT can help patients improve communication skills, build social support networks, and develop realistic expectations about their therapy. So please look further into IPT. It has efficacy in working with people that are experiencing Sizeism. Transcranial magnetic stimulation is a treatment that uses magnetic pulses to stimulate an area of the brain that plays a role in mood regulation. I'm not a super proponent of this approach. That being said, it is something that I feel like is fair to share with you, depending on your therapeutic identity and what that means to you. And of course, informed consent is a major part of any sort of invasive therapies, such as TMS, and informing your client of what the therapy feels like, what it looks like, and its possible side effects and benefits is a requirement of informed consent before engaging with your client in TMS. And then there are some herbal remedies that have some efficacy. Um, Aerobic and resistance training, yes, and herbal remedies such as St. John's wort, acupuncture, and reflexology can also be helpful when it comes to supporting people who are experiencing Sizeism in larger bodies. And here are a few other references that may be helpful for you if you would like to do further research on how you can support, how you can support your clients who are experiencing Sizeism, particularly in larger bodies, but also keeping in mind that body size um, and mental health disorders and experiences around body size impact all body sizes along the spectrum of bodies, the way we show up. And as always, I trust you to discern, to show up with compassion, and to be supportive and non validating, and also supporting of liberation and acceptance in a compassionate way of all clients, particularly in this discussion, clients in larger body sizes and any clients that are experiencing any mental health disorders or eating disorders around their body size. That is often a response to our society's minimal and minimizing view of body size and standard of beauty and morality. So I hope there was something helpful here. I hope you continue to look further into resources and modalities that might be supportive to your clients. And I look forward to seeing you in the field, loving in this profession and supporting yourself and your clients into the future.